Good afternoon, everyone. My name is Kayla Najera. Today, I'll be discussing a pressing public health issue, obesity and diabetes in Hispanic and Latino populations. These conditions are not only preventable or prevalent, but also deeply intertwined with social, economic, and structural factors. Over the next 20 minutes, we'll explore national and regional trends, disparities, and potential solutions. So let's begin by looking at a broader picture. So nationally, obesity affects 42% of adults and diabetes impacts nearly 15%. What's even more concerning is that 8.7 million people are living with undiagnosed diabetes. Between 2011 and 2023, obesity increased by 23% and diabetes by 21%. These numbers reflect not just individual behaviors, but systemic issues. The economic burden is immense, over 327 billion annually. That includes direct medical costs and indirect costs, like lost productivity. These figures highlight the urgency of addressing these conditions at both clinical and policy levels in public health. When we zoom in on Hispanic and Latino populations, the disparities become even more evident. Obesity affects 47.7% of Hispanic adults, higher than the national average. Diabetes incidence is also elevated, especially among Puerto Rican and Mexican Americans. Hispanic children are 1.7 times more likely to be obese than their white peers. These disparities are not random, they're shaped by historical, culture, and socioeconomic factors. For example, food deserts is predominantly Hispanic neighborhoods limit access to fresh produce, while cultural norms may influence dietary choices. As a Hispanic woman, I could tell you this is actually true with having, your bread and coffee every morning, and whenever you get a chance, I guess, to get your sweets in throughout the day. Let's talk about the social determinants of health. These are the conditions in which people are born, grow, live, work, and age. For Hispanic communities, factors like income, education, housing, and food access play a major role. Studies show that these determinants account for 50 to 60% of health outcomes. Imagine a family living in a low income neighborhood with limited access to healthcare and healthy food. You only wonder how can we expect them to manage or prevent chronic conditions like diabetes. So addressing these root causes is essential for sustainable health improvement and addressing this major issue within this population. Beyond individual and community level factors, structural challenges persist. Historical practices like redlining have led to housing segregation, which in turn often affect access to safe space for physical activity. Many Hispanic individuals face limited access to culturally competent care, which can then lead to mistrust um, and underutilization of health services. Additionally, policy gaps such as lack of insurance coverage for obesity and diabetes treatment create barriers to prevent and manage um, these conditions. So these systemic issues require policy level interventions and advocacy for sure. Let's bring it in a little bit closer to home. So I currently reside in Virginia, and currently 34% of adults are obese, and projections suggest that this could reach near 49% by 2030. So diabetes affects is only 11.4% of adults. Behavioral risks include low physical activity and poor diet quality. The youth is particularly concerning in this topic. Nearly two-thirds of Virginians were overweight or obese in 2021. These trends reflect broader challenges like inadequate access to healthy food and safe recreational spaces. Expanding school nutrition programs and community health initiatives could be powerful tools for change. I also speculate that with the advancement in technology and easy access to tablets, phones, gaming system, that also hinders, the youth to go out and play. I know growing up, this was not an issue for us. I was in a generation where this was just becoming technology was just coming out, and so I remember going out and playing outside. But I noticed that within this generation, amongst my nieces and nephews, they cannot survive without a tablet, and I think that also kind of plays a role in the lack of physical activity that contributes to their daily life. Nationally, Hispanic adults often consume high levels of sugar sweetened beverages and low amounts of fruit and vegetables. Only 25.8% meet federal physical activity guidelines. Sedentary behaviors like increased screen time are rising. These patterns are influenced by work schedules, urban environments, and cultural norms. For example, long work hours and multiple jobs may limit time for exercise or cooking healthy meals. Addressing these behaviors require culturally sensitive education and community engagement. Disparities are also evident across socioeconomic and racial lines. Diabetes is 2.4 times more prevalent in low income adults, and obesity is 3.1 times higher in Black adults than Asian adults. These statistics underscore the intersectionality of health disparities. It's not just about race or income, it's about how these factors interact. Public health strategies must be intersectional and inclusive to be effective. So again, it's just not impacting the Hispanic community. It is ultimately affecting everyone in different communities in different pace. So over the past 2 decades, obesity among Hispanic adults rose from 35% to over 45%. Diabetes increased from 8 to 13%. Cardiometabolic risk like hypertension, um, this dyslipidemia are also rising. Youth obesity trends are especially alarming in low-income communities. Something to also be mindful about is learned behavior. So if a child sees that their mother or they are being fed unhealthy food choices because of their economic status. This also tends to be something that they learned. So as they get older, if they don't have the proper education and training, they will consider this as normal and will, not address this type of barrier, which is also concerning because then it gets passed down to other generations. So CDC data shows persistent disparities in cultural dietary patterns, such as high intake of refined carbs that play a huge role. Urbanization also contributes to reduced physical activity. I believe that longitudinal studies are needed to understand generational impacts and guide future interventions to help break that generational curse and barriers that are being passed down. Hispanic adults have a 5%, or excuse me, 50% higher risk of developing type 2 diabetes. Supporting literature indicates that obesity prevalence among Hispanic women is significantly higher than men, and children and adolescents show increasing rates of obesity-related complications, which is again concerning, especially at that stage of their lives. In conducting my research, something that was noted that Mexican Americans and Puerto Rican subgroups show the highest rates. Geographic disparities are also notable. So southern and southwestern states report higher incidence. Acculturation and socioeconomic status influences disease burden. For instance, newly immigrated individuals may adapt unhealthy dietary habits due to affordability and accessibility, which is concerning, especially if they come here to, start a new life. You always want to make sure that you are addressing and starting on the right foot. So providing type of resources and educational programs can be very important in this case, especially amongst the Hispanic community um, and immigrants. So let's revisit structural challenges. Limited access to healthcare and insurance coverage, language barriers, and cultural stigma around seeking care all contribute to poor outcome. Structural racism and policy gaps exacerbate these disparities. Health equity means ensuring everyone has a fair and just fair opportunity to be healthy. That requires dismantling these barriers and investing in inclusive systems within these broken communities that don't have anyone to advocate for them. It's increasingly alarming, and this is something that needs to be done, especially in public health, is to definitely educate these communities that are facing these type of disparities, to address these issues and ultimately educate not only their parents but everyone within that family. So I think this is definitely something that has been affected and is very predominant in this type of community. Um, Behavioral risk factors include high consumption of processed and sugary foods, sedentary lifestyles, and limited health literacy. Stress and mental health challenges often linked to immigration status, discrimination, and economic hardships. They all also play a role in the way someone, deals with their daily livelihood. These factors are interconnected. So, for example, stress can lead to emotional eating, which contributes to obesity, or it could lead to just lack of stigma. So if someone is depressed, the last thing they want to do is go out for a walk or have any type of interaction or daily activities and socialize with other groups. So addressing these barriers requires a holistic approach that includes mental health support and is customized within that population and subgroup. So that way we are addressing all the key factors and not just a few of them, which could lead to a better outcome at the end. Diabetes costs the U.S. over 327 billion annually. So direct costs include hospitalizations, medications, and outpatient care. Hispanic population often face higher out-of-pocket expenses due to underinsurance and lack of resources. Again, due to language barriers. Um, Outreach groups and limited resources within that area. So indirect cost, like lost productivity and early retirement, impact families and communities. Prevention is just not a health issue, it's an economic one. Investing in prevention can reduce long term costs and improve quality of life. If you are already coming from a socially disadvantaged family, this is definitely going to be a burden having to work, especially if you have other comorbidities that limit your ability to work. Um, seeking care and paying for insurance may not be an option. So the best thing to do would probably be to seek government assistance if that is an option, and if it is applicable within your household. I know that there are regulations and stipulations that come along with registering for these type of government assistance. So sometimes that is, even although it is an option, it may not necessarily address or cover these certain individuals, especially if they don't have, for example, like an American, if they're not citizenships, or if they are limited due to that type of issue. So what can we do? There's an urgent need to address obesity and diabetes in Hispanic populations. We must engage policymakers through leaders and community organizations, and we also need to culturally tailor um, prevention and education programs that are essential in addressing these issues. So promoting health equity requires inclusive policy reforms and sustained advocacy. Being able to host, mobile care, um, even passing out flyers or word of mouth, engaging others within our community that can also help address these disparities and health issues within the community. If they see that their cousin, went to a mobile clinic to get test strips or insulin, and a family member is also financially unable to do so to seek medical attention, by being able to attend next visit with their cousin, they will also be able to seek medical attention themselves and start treating diabetes and obesity, which is a huge, it could be really huge within that community in addressing these types of disparities and health issues. Solutions include expanding access to preventive care and screening, supporting community-based health initiatives, and collaborating with schools, faith groups, and local leaders. Advocacy for policy changes that address social determinants and systemic barriers is key. We must move from awareness to action at this point, especially with these alarming numbers that keep rising throughout the year. So these insights are grounded in data from the CDC Office of Minority Health and peer-reviewed research. I encourage you to explore these resources further. Thank you for your time and attention, and I welcome any questions or in my discussion post um, response. So I hope you guys have a wonderful evening.